Hi, I'm Jim Gordon in the offices of the Richmond Sentinel. Coming up, we're going to talk with three fourth-year UBC medical students who are from Richmond. They are part of the UBC Medicine Political Advocacy Committee, known as PAC. That's next on Richmond Stories. Who is PAC? They're a group of medical students who every year advocate for the improvements to the healthcare system, and they run a province-wide public education campaign with the results of their research. This group of medical students researched issues related to the healthcare system. They spent 6 months researching unsafe, overcrowded, and emergency departments. They interviewed ER doctors, surveyed medical students, wrote a policy paper with their 5 recommendations, and met with politicians to advocate for necessary changes. 46 UBC students traveled to Victoria to address their recommendations with Premier David Eby, Health Minister Adrian Dix. They also talked with 48 MLAs, additional Greater Vancouver MLAs, and Richmond's 4 MLAs. Well, now as we come up to our main camera back here in the Richmond Sentinel offices, I'm joined by Davy Lau, Kiki Yu, and Valerie Mock. Welcome to all three of you.
Thanks for having us.
You're quite welcome, and congratulations in a time where healthcare is probably most important on people's list of things they want improved by their government. It's great to see you three out there trying to make a difference. Lots of things to talk about, and Valerie, I'll start with you. Why did you choose and decide this topic?
That's a fantastic question. So I'm currently a second-year medical student at UBC, and for myself and my colleagues, we're definitely thinking about what it is that we want to do in the future in terms of medical specialties. And we know that emergency care is vitally needed for our population. But what we tend to see around here is, as the years have progressed, that emergency departments have become increasingly crowded, and the patients appearing in these emergency departments are more complex. And staff are also becoming burnt out because of being overworked, and also rural areas are understaffed. So having a bigger picture of the specialties that are possible, even though someone like me may be interested in primary care, emergency medicine, these are things that we need to consider.
David, over to you. Just kind of pick up where Valerie finished up there and touch on the 5 topics you covered in your recommendations.
For sure, yeah. So after spending several months doing this research and also interviewing emergency doctors and other people involved in health policy, we arrived on 5 kind of central recommendations to help address the overcrowding and the understaffing in emergency departments. So one of them is a focus more on increasing primary care. You'll see a common theme with some of our recommendations is that it's not just focused on the emergency department, but it's focused on more systemic recommendations. So by increasing the number of family physicians, which was already done in this past year through the new funding model, that will help decrease the burden of patients coming to the emergency department, where a large majority of them present because they don't have timely access to an appointment with their GP. So that's our first recommendation. The second one is also trying to figure out how we can ensure safety measures so that people leaving the hospital have a place to go. So increasing long-term care facilities. If there's patients that are spending time in the hospital and they're well enough to leave health-wise, sometimes they actually have to stay in the hospital because they don't have proper housing or they don't have a long-term care facility to go towards. And that actually increases the number of patients in the emergency department because it backs up from all the patients up on the wards. So by increasing the number of long-term care facilities and housing options, that will help decrease the overcrowding in the ER. As well as we have recommendations for ensuring that we have better kind of long-term planning in terms of the workforce. So ensuring that we're using data to figure out how many more physicians and nurses and healthcare staff we need to recruit in the next 2 years. And then increasing options for rural transport. So transferring patients from rural emergency departments to urban hospitals if needed, That's a really big need in these rural areas. So those are some of our main recommendations.
And I should say Davey. Sorry, I called you David. Davey, thank you very much for that. Kiki, of course, with government, there's always challenges, bureaucracy. What do you hope to accomplish? That's for
I
Kiki.
think, yeah. Yeah, I think that's a great question. And of course, I think at the end of the day, we'd like to see improvements made to our emergency departments, a reduction in overcrowding, increased staffing, and also hopefully alleviation of some of the urban-rural disparities as well across the province. Um, and this, of course, is just one step that our student body has kind of taken by, working together, creating this paper, making these recommendations, and showing that medical students, the province's like future physicians and healthcare workforce, are that we really care about our emergency departments and hope to see improvements made so that by the time that we are also stepping into the hospitals, hopefully the environments will be better, and it'll be a problem that will be easier to solve as we move forward, and hopefully not see it get worse.
Yeah, let's hope that goes that way. Valerie, I'll go back to you with this, and pardon my cynicism, of course, but we all know that politicians can make promises and they don't often get kept, or they get caught up in whatever happens. But how will you gauge if the politicians take action and if they don't? And then what can you three and the people in your camp do to hold them accountable?
That's a great question. So the committee that the three of us work with is the UBC Political Advocacy Committee. And we actually spent a couple weeks back speaking to them both on Zoom and in Parliament in Victoria. So what we want to do is really bring this problem we feel to the forefront of their minds, especially with the elections coming up. And we want to make sure that they know what's going on and that we are able to propose things that they have the power to either speak to their uppers about it or be able to enact.
We should mention, I will certainly bring it up at the end as well, but we should mention that you can read the policy paper. It's Enough Waiting, a call to resuscitate BC emergency departments. It's at ubcmedicinepac.ca. Talking with Davey Lau, Kiki Yu, Valerie Mock, UBC medical students from Richmond, and getting their thoughts on some of the things that are of concerns to citizens. Davey, I'll go back to you. Besides visiting BC politicians, how are you marketing your association and the valuable work that you do every year?
Yeah, that's a great question. Really, kind of the main engagement that we're doing is with the politicians, specifically with BC MLAs. We make an effort every single year to meet with as many MLAs as we can and to ensure that we're meeting across the party line. So this year we had the privilege of meeting with MLAs from every single political party represented in the Legislative Assembly. So that was really important to us. And then the other aspect that we're doing is really just trying to get the word out. Whenever we do a policy paper and we do this research, we want to engage as many healthcare workers as possible. So we not only interview them and kind of include them in our research, but once we're actually finished with the policy paper, we do disseminate these findings amongst the medical student body, as well as to other physicians in our community. So that's really how we're trying to get the word out. And also, this is definitely a concern that's relevant to the general public. So, doing these media interviews and writing newspaper articles, which we've done this year, that's really helping to ensure that not only the medical community, but also the general public is keeping the government accountable to them.
And Kiki, as I mentioned off the top, you determined group. You have met with Premier David Eby, Health Minister Adrian Dix. You've also met with a number of MLAs, Vancouver MLAs, and Richmond's 4 MLAs. Kiki, you get the last word here. How have you found their reactions? Supportive? Give us your thoughts on how it's been meeting with them.
Yeah, I think the reactions that we've gotten kind of across the board have been very supportive, and I can see that in our meetings with David Eby, everyone's aware of the issues with the emergency departments, and certainly very open to looking at the issue from a number of different perspectives. Like, of course, like we've already put in some work to bolster our primary care services. But I think they've also been very open to hearing about some of our other approaches that we've suggested in the paper, like long-term care, bolstering specialist services, and also using data to drive our future planning. So it's been really great to meet with them and to have them also make time for us to present our ideas.
That's excellent. I mentioned your policy paper, and again, I'll bring it up. Enough waiting, a call to resuscitate BC emergency departments. UBC Medicine PAC.ca is where you can find that paper. Is there any other areas where people can find out more about you, support you? It's your avenue right here to say some more things about that. Any one of you can take that, I should say.
For sure, yeah. I think the main way is through the website, but we also have very active Twitter accounts. So the UBC Medicine PAC or PAC Twitter account is also where you'll find a lot of the photos with all of the meetings that we've had with the MLAs. And also our Instagram page will also contain all of that too. So we've documented very well all of the people that we met with. And you can find links to our website and our policy papers through those social media accounts.
I want to thank you three. It's been a pleasure to speak with you all, and I congratulate you on your work, your determination, and your commitment to an issue that, as I said off the top, is very important to voters and citizens of this province during this very trying time. It's Davy Lau, Kiki Yu, and Valerie Mock. They are UBC medical students at UBC, and they're also from Richmond. Thank you, all three of you, for joining us.
Thank you so much for having us and for listening to this important issue.
Good luck with your careers and keep going. It's great to see that. And thank you for watching. I'm Jim Gordon from the Richmond Sentinel office. This has been another Richmond Stories.